Rhodiola has been proven to help people with all the factors they need to lose weight. It boosts energy. It reduces stress-related mental fatigue. It burns fat. How much weight can you lose with rhodiola? In a clinical study conducted by the Georgian State Hospital, overweight patients were given rhodiola rosea extract for 90 days. At the end of the study, 92% of those patients had lost an average of 20 pounds and a whopping 11% decrease in body fat. Does rhodiola speed up metabolism? Rhodiola rosea, RHO, has been reported to have various pharmacological properties, including anti-fatigue, anti-stress, and anti-inflammatory activity. It is also known to improve glucose and lipid metabolism, but the effects of rhodiola rosea on adipocyte differentiation and metabolism are not still elucidated. What does rhodiola do to the body? Today, rhodiola is promoted to increase energy, stamina, strength, and mental capacity, improve athletic performance, resist the effects of stress, and help manage depression, anxiety, and other symptoms. How long does it take to see results from rhodiola? While some research has found rhodiola rosea could take effect within a matter of days, you'll experience maximum benefits by consistent use. Most studies and clinical trials show it takes about 4 weeks to see improvements. However, there are few, if any, long-term studies longer than 6 to 10 weeks in length. How to take rhodiola for weight loss? It is recommended to take rhodiola in doses between 288 to 680 milligrams per day. While rhodiola is effective as a standalone supplement, it can also be even more effective for weight loss when taken in combination with other nootropics. Should rhodiola be taken in morning or night? How much and when to take it? It's best to take rhodiola on an empty stomach but not before bedtime, as it has a slightly stimulating effect. 26. Most people take rhodiola extract in capsules or tablets containing between 100 to 200 milligrams with 3% rosavins and 0.8 to 1% salidroside. Can I take rhodiola every day? Many rhodiola supplements range from 100 milligrams to 500 milligrams. The recommended dose is 200 milligrams twice daily. In some studies, people were given up to 1,500 milligrams per day. Does rhodiola affect hormones? Rhodiola acts like a hormone thermostat, especially as it pertains to cortisol, one of our main stress hormones. This is largely due to its high levels of a phytochemical known as salidroside, which balances cortisol production, relieves anxiety, and combats aging. How does rhodiola make you feel? Improves energy. Since rhodiola helps balance brain chemicals such as melatonin, that makes you sleepy, and serotonin, which makes you feel energized and happy, this root also helps you fight fatigue. Can you drink coffee with rhodiola? Not sure when to take rhodiola? Consider adding it into your morning routine, a scoop of focus blend or packet of lion's mane elixir on its own or in your cup of coffee, to support the stress of the day and give your brain a little extra boost of focus. Why is rhodiola taken on an empty stomach? Most people recommend taking rhodiola extract on an empty stomach, as this improves absorption. If you're taking rhodiola for fatigue, take it first thing in the morning. If you're taking it for increased performance, take it a couple of hours before you work out. Is rhodiola good for skin? When used in skincare products, it boosts microcirculation, stimulates the production of collagen and elastin, and protects skin from environmental stressors like UV rays. Rhodiola root is a holistic workhorse. Does rhodiola affect the heart? Rhodiola rosea was found to prevent stress-induced cardiac damage. Simultaneously, myocardial catecholamines and CAMP levels were measured. Rhodiola rosea was ascertained to prevent both stress-induced catecholamine release and higher CAMP levels in the myocardium. Does rhodiola cause sleepiness? An added rhodiola rosea benefit is that it supports sleep. In a study of patients with obstructive sleep apnea, rhodiola was shown to inhibit free radicals and improve anxiety and depression over 3 months. Reducing stress and anxiety certainly helps address the root cause of sleep issues. Should I take a break from rhodiola? Furthermore, it's worth noting that long-term use of rhodiola hasn't been studied. Due to this lack of evidence, we suggest you cap your rhodiola supplement intake by the 3-month mark. From there, give your mind and body intermittent breaks lasting at least a week or 2 before starting again. Does rhodiola raise blood pressure? Rhodiola might lower blood pressure. Taking rhodiola along with medications that lower blood pressure might cause blood pressure to go too low. Monitor your blood pressure closely. Can rhodiola affect menstrual cycle? Rhodiola rosea has been shown to restore menses in women when given at a dose of 100 milligrams extract orally twice a day for 2 weeks, or 1 milliliter rhodocin intramuscularly for 10 days. In a study of 40 women given these dosages, menses was restored in 25, and pregnancy ensued in 11. Does rhodiola increase dopamine? Rhodiola exerts multiple effects on the central nervous system, including improving dopamine stability and inhibiting dopamine reuptake, helping to reduce anxiety and fatigue and boosting the brain's ability to handle stress. Does rhodiola increase fertility? Fertility. Rhodiola has been shown great results in enhancing fertility in women, even among those that have failed to conceive with standard fertility drugs. It also improves sexual performance in men with erectile dysfunction and/or premature ejaculation. Does rhodiola rosea cause weight gain? Rhodiola has been proven to help people with all the factors they need to lose weight. It boosts energy. It reduces stress-related mental fatigue. It burns fat. Does rhodiola make you smarter? Many studies have shown that rhodiola rosea can improve cognitive function, memory, and mental performance, particularly under stressful conditions. For example, in randomized controlled studies, RCTs, people given our rosea made fewer mistakes than those given placebo.